Hi, my name's Stacy and I am Kyle's mom, and I'm doing this video to talk a little bit about the vision therapy program that we enrolled Kyle in with Dr. Stern. He was 7 when we started the program, and he did it for just under a year, and he saw Dr. Stern once a week. What brought us to Dr. Stern was some ongoing difficulty in school. He was reversing his letters and his numbers, and he was having trouble keeping his place while reading. He was skipping lines, and he didn't really notice that he was doing that. Or when he would fill out a worksheet, he would answer questions kind of all scattered around, and then even when he was asked to go back and check his work, he couldn't find it in himself to start from, top to bottom and work left to right. We started seeing these types of problems when he was in kindergarten, and we were told that it's all within the age range for that particular grade and not to worry about it. And the issues continued in first grade, and we were pretty much fed the same line. It's all within grade level, but he was starting to get poor marks on his report card. And that's when we started really pushing back on the school a little bit. Kyle has a November birthday, so we felt that given his birthday and the declining marks on his report card, it really wasn't an age range thing. So we had the school do a Connors behavior scale, and he also met with the psychologist of the school. They told us after those 2 reports that he had extreme difficulty with near point copying and some visual scanning and motor planning, and that was the end of it. And we were they referred us back to his pediatrician to see if we could discuss his inability to focus and maintain attention, which it really wasn't where we wanted to go with this. I mean, Kyle had extreme ability to focus his attention on anything that captivated him, to the point where you'd have to shake him to break his train of thought. So we didn't feel like he had anything in the ADD realm. So we went back to the school and we pushed for an OT screening. And the OT screening came back suggesting the use of a slant board and a highlighter. And we still weren't really happy with that. I mean, in marking periods had come and gone, and he was still in a real gradual decline, still reversing letters and numbers, still unable to read a full paragraph without skipping lines. So when going back to the school, we had a speech and language evaluation, and we also had an evaluation by the learning disability teacher. And it was interesting because on the speech evaluation, he had below low average tests on his word structure and familiar sequencing. Everything else was high or superior. And that particular therapist called him an enigma. On his learning, the learning disability evaluation that was done, she noted that he reversed many letters and numbers when writing, writing a story from his own mind, writing words that were dictated to him, and copying. And the school basically said that vision wasn't an area in which they support, and that we should go see an ophthalmologist. So we took him to the eye doctor, and the eye doctor said, well, no, he has 20/20 vision. There's nothing here. It's definitely a learning thing. Something's going on in his brain. And we went back to the school, and it was when we went back to the school that I happened to meet the occupational therapist who had done his evaluation in the hallway, and she slipped me Dr. Stern's name and number. We had no idea what a behavioral ophthalmologist was. We knew something was wrong with Kyle in the way that he learned, and we knew he needed help, and we had hit a wall with the school. After meeting Dr. Stern, just sitting in that original first evaluation with her, I was floored by some of the tests that she was giving Kyle, and seeing him not even be able to copy 5 shapes from a board accurately, or being able to tap his feet to the tone of the metronome, or be able to do jumping jacks while counting by 5s. And when she was explaining the types of kids that she sees, and the types of things that they demonstrate at home, I just kept thinking, my God, she's describing Kyle, and he didn't have a lot of coordination. He didn't have a lot of confidence. He couldn't dribble a ball. He couldn't hit a ball with a bat, along with all these issues that he was having in school. So throughout the course of the year, he saw her once a week, and we also had a whole menu of exercises and activities that we did at home, and they were pretty silly, but just amazing things. And within the first couple of months, we saw dramatic improvements with Kyle. He started, before we saw Dr. Stern, he was in first grade with marks that were almost making him at risk of staying back. He started second grade in September when he started seeing Dr. Stern. His first report card, I believe, came out in November, and he was already meeting the grade requirement or above. We were so happy. We met with his teacher. She said that he was keeping up with all of the other students. He didn't need to be pulled out anymore, because he had been pulled out in first grade once a week for 10 minutes to meet with a reading specialist, which it really wasn't going anywhere. And reading per se was not his issue. It was following the lines. So his whole second grade year, he got fantastic marks. He got goals in soccer. He was performing unbelievable in basketball. He's a completely different kid. He just finished third grade, and all of his marks were commendable. He enjoys going to school. He's captivated by the reading, and he's not pulled out for anything. He doesn't feel incompetent or incapable of doing anything. And it's funny because every once in a while he will bring up vision therapy, and it still perplexes him. And I'm still just as equally in awe of what he was faced with, and how it all came about, how he was able to break through whatever it was that was blocking his ability to just write a sentence without